All right, and it started recording. All right, cool. Well, welcome in everybody. Thank you for taking the time out of your day and welcome to the first ever Bloodline Mobility Clinic. All right, so I'm gonna go ahead and share one of my screens with you guys real quick. That's gonna be the presentation that we're gonna go through briefly. It's not gonna be as long as the nutrition course or anything like that, but it will kind of give you a little bit more guidance as we go along. So this is the first ever Bloodline Mobility Clinic. So thank you guys for just taking the time out of your day and your commitment to try to learn a little bit something new. A lot of the things that we'll cover today are going to be a lot of problem areas for most people within in the fitness realm and overall in general. So a lot of people deal with like chronic injuries, pain, inflammation, muscular imbalances, and things like that. So today we're going to address some of those key issues and some of the most common physical ailments that people see when it comes to like fitness and stuff like that. So those are some of the things that we can look forward to through the mobility clinic. So this will be the overview of what we're going to go over today. So we're going to go through basically an introduction and why a mobility routine is important for your success in fitness routine or overall just to feel more comfortable, and then being able to create your own corrective exercise routine that's personalized to your needs and your body. All right, so we're going to go over the key areas of focus. We're going to go over foam rolling technique, stretches, strengthening, and then a mock program to make it make sense at the end. All right, so we're going to all put it all together at the end. So what I thought would be important to start off with is what is mobility in the first place. All right, so people often have the misconception as there being the same thing as flexibility. So mobility and flexibility being the same thing, but that's often misrepresented and they're two separate things. All right, so flexibility is basically the body's ability to, the muscle's ability to lengthen passively. So basically just bending over, touching your toes. That's an example of of having flexible hamstrings. So just that passive stretch, just bending over, you feel this stretch on the backside of your legs. That's what it means to be flexible or having flexibility within your muscles. All right, mobility is more of a broadened term. It's kind of more generalized. It basically means the joint's ability to move through a dynamic range of motion. So being able to raise your arm above your head, that shows that you have good joint mobility within your shoulder, or even going into a deep squat, that shows that your hips, knees, and ankles have good joint mobility. But also you have to kind of keep in mind that you need the flexibility in order to get to those positions too. So mobility is intertwined with flexibility, also strength and other things like that. That's why it's more of a broad and generalized term. So yeah, exactly like I said, some examples would just be a regular old static hamstring stretch, and then of flexibility, then a squat will be more of a mobility kind of term. All right, so that's just some key differences. So why is it important? Why is it important to be mobile and being able to have a mobility routine within your exercise regimen? So we often go through life thinking that pain is normal, even when it comes to, even if we know where it comes from. Society has taught us that we need instant results. That's why the first thing we reach for is oftentimes things like ibuprofen, painkillers, surgery, and other kind of those simple cover-up issues that is often prescribed to us. I don't want to take, first off, I'm not a doctor or anything like that. If your doctor recommends it, I'll say go with your doctor. But if there's something that you could do to mitigate those effects of like poor posture, muscle imbalances, things like that, I'll say go for that first, and then kind of go down the list and see what works best. Because if you could avoid those traumatic interventions, then that would probably be best. So one thing why it's important, I want to show you guys this graph. It's called the cumulative injury cycle. All right, so you kind of see it goes around in a circle. It starts off with tissue trauma. These could be things like muscle strains, just aggravated muscle, things like that. That leads to oftentimes inflammation, muscle spasms, causing the muscles pretty much to freak out and kind of contract on themselves. That'll lead to muscle adhesions, which will cause the muscles to shorten, causing a lot of pain and discomfort in the joint area. This will alter your mechanics. Basically, you'll, like say, for example, I have a little twinge in my quad, all right? And throughout time, I get inflammation there, muscle spasms, my quad starts to shorten up, and that causes a lot of pain in my knee, all right? So the muscles in that quad connect to your knee, causing a lot of pulling and discomfort. Then I start walking differently. And eventually that's gonna lead to my hips being all, having an asymmetrical shift, which will mean they're just imbalanced, causing me to put more pressure on one side, eventually leading to lower back issues, maybe even a little bit of lordotic curve in a low back. And that goes up the list. So you get muscle imbalances. If I try to squat on that, having that poor mechanics or having an uneven surface to work from, like say, for example, one leg is dropped lower than the other, that could cause injury. So I'm basically putting all my weight onto one side. For example, if I go down in a squat, coming out of that, certain muscles are going to fire at different rates than they're supposed to, and that will cause injury. And that cycle just goes on and on if the issue isn't addressed properly. All right, so these are some statistics that you could look at too. So over 1 million people a year visit the doctor due to plantar fasciitis, and ankle sprains are the most common sports injury. All right, we're just gonna go through the list as far as any kind of mobility issues and joint issues. So over 1/3 of work-related injuries revolve around the trunk, which are pretty much this section here. So like your thoracic spine, lower spine, and things like that. So 60% of these issues are due to lower back problems, and research shows that people who sit for longer than 3 hours at a time are more prone to altered lumbar lordosis, which basically means you have a curvature at the bottom of your spine, causing your hips to dip forward and your butt to poke up, which will cause a lot of lower back pain. So roughly about 80% of adults have some sort of back pain. 100,000 doctor visits are due to ACL injuries, and roughly out of those 100,000 visits, about 75% are non-contact injuries. So many people experience arthritis in the knee from like those ACL issues, most commonly caused from like ankle sprains, any kind of misalignment of the hips that causes the ACL to kind of not have an even pull on that knee and causing a lot of injuries as well. So shoulder issues are reported in 20% of adults. Many stem from just what is known as an impingement, and that messes up the mechanics of the shoulder, causing pain and discomfort. Oftentimes we'll see people not be able to raise their hand past this. That's mainly because of there being some sort of shoulder impingement within that joint, which is basically due to our society's, I guess, lifestyle. So oftentimes being on a computer, you're rounded forward like this. Being on your phone, your head is protruding forward, your shoulders are caved in like this. So that leads to a lot of shoulder impingements, muscular imbalances. So what we're here to do today is kind of learn the basics of how to address and hopefully fix some of those issues that some of us may be dealing with. All right, so that will get us into how to create a corrective routine, corrective exercise routine. So I break it down into 3 sections just so you know kind of ahead of time what we're gonna be looking at. So the 3 phases I break it down to is gonna be step 1, self-myofascial release, which is basically foam rolling or some sort of massage. So the purpose of this is to inhibit tension in areas that are overactive or shortened, that the areas that are oftentimes too constricted or too tight or limited in its range of motion. So being able to foam roll and reduce the tension will relieve a lot of soreness and improve circulation. So step number 2 is going to be lengthening and stretching. So after you foam roll the muscle, get it primed up and get it kind of lengthened at a time, you want to be able to stretch that muscle to get it brought back to its proper length. So this will reduce stiffness, increase range of motion, and improve your posture overall. And the 3rd step, since you got that muscle back to where it's supposed to be, you got to strengthen and reinforce that new range of motion that you just found. So you will then strengthen the muscles that you identified as weak or lengthened. This will reinforce new movement patterns and range of motion that you just created. But your job doesn't stop there. Lastly, being able to reintegrate these methods into your routine. So with creating new ranges of motion, let's say, for example, I wasn't able to get my shoulder above my arm above my head, but now I'm able to get it all the way up here. What I have to do, my body is adapting to this new range of motion, and I don't have control or strength over this part of the range of motion. So I have to learn how to reteach my shoulder how to have control over this, all right? So you don't want to have flexibility or mobility without strength, because then you're just kind of leaving this part of your shoulder to susceptible to injury. So you want to make sure that the newfound range of motions have strength in that new place, all right? So that is going to be leading us to our areas of focus for today. So we're going to go through 3 exercise routine or corrective exercise routines. So we're going to go through low back or the lumbopelvic hip complex, which is basically just your hip area and your lower back area. We're going to go over some knee issues and kind of address some of the main causes for that. And then if we have enough time, we're going to squeeze in some shoulders. But if we don't, It's going to be listed on the PowerPoint, and hopefully we'll be able to kind of touch up on that soon. All right, so we're going to try to see what we can squeeze in. Throughout this workout or throughout this clinic, we're going to go over things like this. So we're going to go through the few steps for lower back, lumbo-pelvic hip complex, go through things for your knees, and go through things for your shoulders. All right, so this is an example of what it will look like, but that's enough of this right here. Let me go ahead and, there we go, cool. All right, we're back on it. So I'm gonna go ahead and get you guys set up. So if you can, please ever so kindly grab up your foam rollers, and we're gonna get into the meat and potatoes of what we came here to do today. All right, so we're gonna go through, firstly, we're gonna address the lower back and lumbo-pelvic hip area and being able to get into the nitty gritty as far as like some basic, let me close that out. All right. Some basic methods and how to better or improve lower back pain, etc. All right, so some of the mobility modalities that we can use are things like a dowel rod. So I have this dowel rod here. Oftentimes it's pretty helpful to kind of help increase range of motion, and it is a helpful tool to have. You can use things like a band, a stretch and elastic band like this. You can use a softball or lacrosse ball in place of the foam roller to get some of those smaller nitty-gritty spots that are a little bit more squeaky. And then some things that help with strengthening overall could be things like a hip band or going back to your elastic band. But before we get into a lot of the corrective exercises that we have today, I'd like you guys to firstly take off your shoes, please. All right, that's gonna be the first step. I think you guys are comfortable at home, so I wore sandals, so I'm gonna go throw those off. All right, cool. So now those are out of the way. So we're gonna go ahead and do an assessment. So it's important to kind of put a baseline as far as what your mobility looks like, so you have something to reference back to. So for example, first thing we're gonna do is go into 10 squats, so 10 air squats. And then I want you guys to really pay attention to like your knees, your hips, your ankles, your back, everything. If you notice any kind of impingements, any kind of pain, any kind of limited range of motion, I want you guys to take a mental note of that and be like, okay, these are the trouble issues that I have today. Let's see how it feels at the end, because we're going to start with this assessment and then we're going to end with it as well. All right, just to see where we improved and how it felt. All right, so we're going to go ahead and just stand in a neutral position. So with your feet shoulder width. All right, you can turn out the toes just ever so slightly. And what we're going to do is just do a slow and controlled squat. So I want you to watch me first. I'm going to go 3, 2, 1. Coming all the way back up out of that squat. And I want you guys to get down as deep as you can. If you feel any pain at any moment, start coming back out of that squat, okay? So we're gonna do 10 reps, nice, slow, and controlled, just like that. So count down in your head, 3, 2, 1, and then come on up. Not explosive, but just take your time, all right? Go ahead and do 10 reps for me. Good job, Susie. There we go. And also pay attention to where your knees go, what your ankles do, what your feet do. If you fall forward really far, and where your head position's at. Very good, Takia. There we go. You even might notice that maybe you even feel a little imbalance going down. All right, so just keep it nice and controlled, all the way down. Bring it all the way back up. All right, don't go past the point of pain, because that's a high sign saying that your body's like, hey, don't do that. There you go. Awesome squats, you guys. And go ahead and relax after you do 10 reps. Take it nice and slow and controlled. Thank you, Susie. There we go. Very good. Perfect, you guys. All right, so there we go. Good. Cool. So that is a squat assessment. Very basic and straightforward. So your squat mechanics is heavily dictated by your lumbo-pelvic hip area, also your knees and your ankles. So if there's any kind of deviation in your joints at that point, you're going to notice it in your squat. So for example, if I squat down and my chest falls forward like this, that means I have too tight of core, elongated spinal erectors, and then my hamstrings are overly stretched, all right? So, or for example, if your toes point out too far like this, I squat down, my toes point out like that, it means I have an ankle mobility issue, all right? But we're gonna go ahead and start things off like this. We're gonna go ahead and hit up that lower back and lumbo-pelvic hip area. So first thing we're gonna go over if we're gonna go ahead and hit those glutes, hit the hips, and hit that piriformis, which is a small hip flexor and that glute area. So one thing we don't want to do, we don't want to, especially if we have any disc issue, we don't want to foam roll directly on that lower back with the foam roller going over that lordotic part of our spine. And so especially if you have any kind of sciatic issues or anything like that, you don't really necessarily want to foam roll that back area. You want to kind of stick to the glutes and in the hips. All right, that's going to be the primary issues with non-contact injuries, or even if you're sitting for too long a time. Being able to inhibit the muscles in your glutes and your hips are going to make a big difference in how you feel in your back, okay? So first thing we're going to do, we're going to foam roll those glutes. All right, so I got this regular roller foam roller here. Anyone will do, depending on how hard it is and how much give it has, it's going to dictate how well it works. All right, so you want to start as like a light level like Takia has. So those ones have a little bit of give. They're kind of a round surface. They cover a lot of surface area. So that's a good place to start if it's your first time foam rolling. Then eventually you want the ones with the nodules on it, kind of get a little bit deeper in that muscle tissue as your body gets more resilient and kind of is used to that foam rolling feeling, okay? So we're gonna go ahead and start off with this. I'm gonna bring my computer down real quick. Well, bam! All right, we're alive and well. All right, cool, let's see how this works. Bam! All right, so we're gonna use this foam roller on our glutes to start off with. So it's gonna be as basic as it sounds. You're gonna go ahead and sit on it with both butt cheeks right on that foam roller. And what you're gonna do, you're gonna just lean over to one side, posturing up on one hand, and then you're gonna have facing off with one leg, all right? So you're gonna have just rolling on one butt cheek. So you're gonna end up getting your glutes. So you're gonna roll all the way to the bottom of the cheek, and then roll all the way to the top of it, almost get into your tailbone, and then going back and forth. If you don't feel any like speed bumps or any kind of itchy or any kind of sticky areas, then there's no issue with your glute. And what you want to do is just go ahead and switch it over to your other side. All right, so you're going to just fall over, posture up on the other hand, just roll it back and forth into that glute. So this is pretty straightforward. You could, some other methods to do with the foam roller too, is just oscillate the leg back and forth and around, just so you kind of get that hip to go through its range of motion. And it kind of massages the muscles and allows it to kind of wiggle around into different areas. Takia, do you get is there any kind of sticky points in there or not too much? Yeah. So you notice a lot of times when people sit in for long periods of time, their glutes get a little bit more, I guess turned off is a good word to say. The neurons don't necessarily fire as actively. So once you put all that pressure directly on that glute, you start feeling it and all those, it starts to loosen back up and wake back up. All right, so that's one thing you want to pay attention to, is just how your glutes feel throughout the duration of this foam rolling. Next thing we're going to get into is going to be how to foam roll your piriformis. So that's a small muscle that goes from the small of your back all the way across to your hip. All right, and that's really responsible for a lot of sciatic pinching and stuff like that. All right, so we're going to go ahead and I'm going to lean over to my one glute. That glute that has the pressure on it, I'm going to bring that leg up and over and put that ankle onto my knee. So I'm going to be pretty much stretching out the muscle fibers so that I'll be able to get deeper into the glute or into that piriformis area. So you may notice, even bring your leg up and over, you feel a strong stretch, and then wiggling it back and forth, you kind of notice, yeah, some painful areas. Maybe even at the top of your glute, right? Cool. And for foam rolling, you really want to hit, you want to not just roll back and forth, right? So you want to find those pressure points that feel a lot of pain, and you want to hold it there for about 15 to 20 seconds, all right? And make sure that we're breathing, big breaths in, big breaths out throughout the duration that we're doing it, okay? And probably do, if you're just starting, do like 3 rounds of that. Just find that spot, that little sweet spot, hold the pressure there 15 seconds, big breaths in, big breaths out, then release it, then find it again, and then knock it back out again, okay? Just do that 3 times to start, and then switch over to your other glute, okay? Very awesome, you guys. Nice, good. Cool. We're gonna go ahead and skip forward a little bit. We're gonna go ahead and knock out that other glute. Let's go ahead and roll it over to that other glute. Posture up with that hand here on the outside of your body. Bring that leg up and across, and try to drive that glute into that foam roller. All right, so depending on how much comfort you have or much discomfort, you could extend that leg out to lessen the stretch a little bit, or pull it closer in order to kind of lengthen that muscle a little bit more, right? And then make sure you posture up on that outside hand, and then find that sweet spot again, and sit on it. One side is usually going to be a little bit worse or a little bit more sensitive than the other side. So if you find one side is a little bit more tender, kind of focus on that side a little bit more, okay? You're gonna, sometimes people that drive, or people that drive often too, their pedal leg is kicking, there's gonna be flexing, extending, flexing, extending. So they oftentimes get it in their pedal leg too. All right, so awesome job, you guys. Cool. So go ahead and relax off of that one. So we went over, first one we did was the glute. Second one we did was the piriformis. Lastly, what we're gonna go through is the hip area too. Whenever you foam roll your hip, it'll be helpful if you have like a lacrosse ball or something that has a little bit smaller surface area, so just so it can get up in that nook and cranny. A regular foam roll will work just well too. But basically what you're gonna do, there's multiple muscles in the that causes hip flexion, which is basically the sitting position here. So being at this 90-degree here. So there's a lot of different muscles that cause that. The one we're gonna isolate right now is called the TFL, or tensor fascial latte, something like that, TFL. All right, so it's gonna be, so this is the front of my hip. So it's gonna be about at a 45-degree here. So what I'm gonna do is find that 45-degree spot on my hip. I'm just gonna lay on it. I'm gonna put one leg underneath my other leg, place myself on my elbow, lay at 45 degrees on my hip, and just kind of wiggle this foam roller back and forth until I find a spot that hurts a little bit. And then again, hold it there for 15 seconds at a time. Kind of wiggle it back and forth a little bit. Make sure we're breathing in and out. It's kind of, the hardest part is getting into the position. All right, so both legs are together here. One leg is underneath, and all I'm gonna do is use this foot as a lever, just bringing it up and over my body. And see, I'm resting comfortably. You don't want to be all like mixed up and uncomfortable. I just rest comfortably. All right, and just drive your weight into that hip, right? You found a sweet spot, Takia? All right, so same thing. Take about 15 seconds each pressure point. Focus on it. If you have a lacrosse ball, that'll help out a lot, just getting into that little space in there. But foam rolling would definitely help out too. All right, so that is the hip area or the hip flexor that you want to stretch out for that lower back issue. All right, so I'm gonna go ahead and have you guys hit up that other side. So same thing. I'm just gonna lay flat on this foam roller, go to about 45 degrees. Bring this leg up and over, and just wiggle myself back and forth, basing off of my elbow. All right, you can use this foot too as a lever, kind of bring you back and forth, back and forth. Make sure you feel that nice, good massage in there. And even doing just this, you might notice a little bit of relief. All right, but that's not the full formula. We got to make sure we stretch it and then strengthen it back up, and then being able to reintegrate things back. All right, so I'm gonna give you guys a few more segundos to kind of wiggle around and find that good sweet spot in there. And then we're gonna switch it over. All right, so this will take us over to our first group of stretches. So first thing we're gonna go to is called a couch stretch. So you can go ahead and slide that foam roller to the side, or if you wanna keep foam rolling, hey, be my guest. All right, so the first thing we're gonna do is gonna be called a couch stretch. I'm gonna lift this camera up just a little bit. There we go, that's perfect. All right, so I got this tire in front of me. It's gonna be in place of a couch, but all you want is to have an elevated surface so your couch works perfectly. So it's at about the perfect height for this. What you're gonna do is pretty much a pigeon pose, but you're gonna be on this tire or couch. So I'm gonna be here, have my hands planted onto the couch here. All I'm gonna do is drive one knee onto the couch. So basically I'm gonna go into that pigeon pose. I'm gonna have my foot hanging off the couch. I wonder if there's an easier way to do this. So I'm gonna go ahead and put one knee onto the couch. All right, my foot's gonna be hanging off at about 45 degrees. I'm gonna sink my hips down and rest my chest, if I can, onto that knee. All right, so you're gonna get that rotation in the hip, and you're gonna feel good pull on the backside of that glute here. All right, so I'm gonna do it on the ground just to kind of give you a better view. So what I'm gonna do, I'm gonna put my leg onto the couch, just my knee, and I have my shin is gonna be in towards my groin area, and then from there I'm just gonna sink my hips down as deep as I can. And I wanna be more on the side of my thigh, Susie. So you see how I'm on the side of my thigh, I'm not up on my shin like this. I wanna be on my side, like where my IT band is. There we go, and I wanna have my body squared up with the couch, and then slowly sink my chest down to that knee if I can. And just get to a comfortable position. So I'm gonna be here, and we wanna hold these stretches for about a minute at a time. So I'm just gonna drop my back knee down, and just relax on my front leg. So make sure we're breathing, good constant breaths. Big breath in, big breath out. Beautiful, you guys. All right, so we're just gonna hold it for about 30 more seconds on this side. You wanna give it enough time so where those neurons fire out and be able to send a signal that that muscle is gonna be lengthened back out. And you gotta do this periodically. It's really good to do it throughout the day if you're sitting for long periods of time too. And it's pretty convenient. You can just do it on your chair, on your desk, or wherever. People might look at you weird, but it's all right. All right, go ahead and switch legs. Same thing. So you should feel the stretch through your glute and your hip area here. All right, and maybe even into that IT band a little bit, but primarily all in that glute. So again, hands are gonna be on the couch, driving that knee in between, letting that leg hang off a little, or letting that foot hang off. I'm just gonna drop my knee down, drop my chest to my knee. All right, so this is gonna be the first variation of it. If you wanna progress it, make sure that you're on the side of that knee. Oh, you're good, Susie, I can't. Oh yeah, you're good, Susie, good. And just breathe into the stretch. As you breathe, try to sink that chest a little bit lower every time. Awesome job, you guys. Big breath in, big breath out. Beautiful job. All right, give it about 20 more seconds to stretch out. Again, one side is going to be a little bit tighter than the other, so you might notice it's harder to get in position on one side than the other. All right, and go ahead and rest on up. Shake out that leg a little bit. So we're going to skip down. We're going to go straight to our strengthening and reinforcement exercises. On the PowerPoint that I'll send to you on your email, you're going to have 3 separate stretches, and on top of that, you're going to have 2 strengthening routines too. But we're just going to go through one of each all the way down as we go down through like shoulders and your knees and stuff. All right, so the first, or the strengthening exercise we're going to go over today is going to be called the 90-90 with activation. All right, so basically all that means is I'm going to start off in a 90-degree with both legs. And what I'm going to do with this outside hand, I'm going to supinate it. So that means my palms can be facing the ground, and my forearms can be facing you guys. All right, so my back leg is at 90 degrees. So my arm is out, and my knee is directly underneath my arm. And my back leg is in a straight line. So I'm at 90 degrees on my back leg, 90 degrees on my front leg, and then I'm sitting up nice and tall with good posture. Yep, and then my hand is towards the ground here. So first thing we're gonna do is the first variation of it, which is gonna be the regress form. All we're gonna do is make sure we're sitting up nice and tall, staying with good posture. All right, palm on the ground. And from here, I'm gonna push my chest towards my shin. All right, so push my chest towards my shin. You're gonna feel a slight pull on that glute, right? Do you feel a little pull on there? Yep, perfect. All right, and what you wanna think about is keeping your knee and your foot on the ground, all right? So making sure that these don't come off, and then making sure that the back leg also stays on the ground. All right, 3, 2, 1, let's go ahead and bring our chest back up, keeping that hand planted here. All right, step number 2, now that we know where to put our chest at, we're gonna drive our foot and our knee into the ground once we hit that stretch. So I'm here, chest nice and tall, good posture, and I'm gonna push my chest towards my chin. At that point where I notice that stretch, then you're gonna drive your knee and your foot into the ground. So drive your knee, you're gonna flex everything. So flex, 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 push, 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 3, 2, 1, slowly release it back up. There we go. So what you're doing is you're activating a lot of smaller stabilizing muscles that are around the hip area and causing them to contract and wake back up. So that's the job we're doing today. We're trying to wake up those frozen or sleeping muscles to make sure that they do their job correctly. All right, so same thing again. So we're gonna sit up nice and tall, palm on the ground. All right, we're gonna push our chest towards our knee. Once you feel that stretch, you're gonna drive your heel and your knee into the ground. In 3, 2, 1, push, 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 everything, everything, go, go, go. Push as hard as you can. Hard, push, push, push. 3, 2, 1, and back on up. Awesome job, you guys. There we go. Good. We're gonna do that one more time. Make sure we drive this knee and that foot into the ground as hard as you can, okay? You're gonna feel that contracting on the backside of that glute. All right, nice and tall. We're gonna push forward in 3, 2, 1. Push your chest forward. Feel that stretch. Once we get into that stretching position, now we're gonna drive our knee and our foot to the ground. In 3, 2, drive, 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 drive. Flex that whole glute, flex that quad, flex everything. Flex, 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 flex. Push. 4, 3, 2, 1, and slowly come on back up. All right, awesome job. Now, last step is gonna be here. So now we made more of a neural connection with our glute on that working side, right? Now we're gonna work on this back leg too. So I'm gonna be here, still in that same position, nice and tall posture. I'm gonna push my chest forward, drive my knee and my foot into the ground as hard as I can. I'm gonna lift up this back leg. All right, so you could do it. You could lift your back leg up like this, right? But you don't have the muscular control right back here. So once you lift up that back leg, you might notice that might cramp a little bit all in here. That's because those muscles aren't used to doing that, right? So you're getting internal and external rotation in your hips. So we're gonna go ahead and saddle up. Go make sure we're in that 90-90 degree position. All right, so knees straight line with my hand, sit nice and tall. That other hand is supinated. We're gonna go ahead and push our chest towards our shin in 3, 2, 1. Find that stretch. Good. Drive the knee and the foot into the ground. Drive, 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 drive. Lift that back foot off the ground. Lift, 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 lift. 3, 2, 1. Reset and bring it back up. Make sure you're breathing. Don't forget to breathe, okay? All right, sitting nice and tall. We're gonna do that 2 more times. Same thing, okay? Let's push it forward in 3, 2, 1. Push that chest forward. Feel that stretch. Drive the foot and knee into the ground. Push, 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 push. Now lift that foot off the ground. Lift, 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 lift. 3, 2, 1. Reset all the way back up. Beautiful job, you guys. Make sure we're driving hard on that front leg, all right? We're trying to wake everything up and get everything nice and activated, okay? All right, last one right here. You should be sweating a little bit too. Come on, let's go. Push that chest forward. Feel that stretch, feel that stretch, feel that stretch. You got a little cramp, Takia? Let's drive that knee and that foot to the ground. Drive, drive, drive. And pick up that foot. Pick it up, pick it up, pick it up, pick it up. Pick it up higher, 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 higher. 4, 3, 2, 1. Slowly reset on up. Excellent job, you guys. Nice. And what you do to one side, might as well do it to the other. Getting out of that, you might feel a little crampy sensation and stuff like that, right? It's a little tight. All right, so these are just waking up all those stiff and sleeping muscles that are surrounding our hip area. Main reason why a lot of these are tight is because we don't work outside of the sagittal plane. We always go forward and back, right? Forward and back. We never work side to side or in the transverse plane, so going around in circles and stuff. So this kind of helps us get back into that groove. All right, so we're gonna go ahead and switch legs. We're gonna go 90-90 on our front and back leg. All right, make sure we're in that good position. We already know how to get there. So this base hand is gonna be supinated, so turning around the opposite way. And we're gonna have our chest tall. Good, make sure we're in that strong position. Let's go ahead and drive our chest forward. All right, feel that stretch. We're just gonna do this one time, just get comfortable in this position. Good, make sure that back leg's at 90 degrees. Good, 3, 2, 1. Slowly come up out of it. Good job, you guys. All right, now we're gonna do 2 rounds of driving our knee and our foot into the ground as hard as we can, okay? So standing tall. Let's go. Push it forward, push forward, push forward. Now let's drive those knee and that foot into the ground. Drive, 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 drive. Keep driving, keep driving, keep driving. 3, 2, 1, and rest. There we go. And it's always good to kind of keep your core tight as well. So keep your core tight while you're driving. That's gonna allow you to push more force into that knee and that foot, okay? All right, we're gonna go one more time. Let's drive that chest forward. Drive, 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 drive. Feel the stretch. Once you get to that stretch, let's go ahead and drive that knee and that foot into the ground. Ready, set, go. Drive, 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 drive. Come on, squeeze that core, drive that knee, drive that foot. 3, 2, 1, and slowly come on up out of it. Awesome job, you guys. Now we're gonna do 2 rounds of lifting that back foot off the ground. All right, so this is where that magic happens. All right, let's tie everything back together. All right, sit nice and tall. Let's go ahead and push that chest forward. All right, let's drive that knee and that foot to the ground. Drive, 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 and lift. Lift that back foot, lift, 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 lift. Still driving that knee, still driving that knee. 3, 2, 1, and reset back up. Awesome job, you guys. All right, so making sure that we're just using our muscles in our hip to move that leg on up. All right, so you don't have to get it all the way super high. Some people may only lift it a few inches. All right, so that's fine. All right, just as long as we're getting those muscles to work a little bit. All right, sit up nice and tall. We're gonna do one last time. Let's push that chest forward. Push that chest forward. Push that chest forward. Feel that stretch. Drive that knee to the ground. Drive that knee and foot. Drive that knee and foot. Knee and foot. Knee and foot. Knee and foot as hard as you can. All right, you should feel that glute contract. Let's lift that leg up. Lift it up. Lift it up. Lift it up. Let's go. 4, 3, 2, 1, and slowly relax and release. There we go. Awesome job. Generally, on like any kind of protocol, you may do that multiple times, like 5 to 10 times. All right, for here, just with time constraints, we're gonna go ahead and relax. All right, if you felt cramping sensation, that's perfectly fine and normal. All right, so that's where we're addressing, where it's cramping is those areas that haven't worked a lot. All right, so now we activated those muscles. Now we want to integrate it into our workout program. So that will help us doing things like deadlifts, bent over rows, anywhere where we need to stabilize our spine and our hips to do a movement. All right, so this is just gonna make us better and more proficient in a lot of those movements. Even whenever, like you talk to people, oh, how'd you throw out your back? Oh, I was picking up a soda can or something like that off the ground. All right, so this is just gonna make us eliminate all those weird injuries, okay? So we wanna make sure that we're healthy for longer and feeling better. All right, so we're gonna go ahead and hit up these knees a little bit. All right, weirdly enough, so your knee's never gonna be the prime culprit if it's a non-contact injury. All right, the knee is gonna be the epicenter between your foot and ankle complex and that hip complex. So if there's anything wrong with that foot and ankle or anything wrong with that hip, that knee's gonna take over and it's gonna hurt a lot. All right, so oftentimes it's gonna be soft tissue damage or any kind of articulation of the joint is gonna be offset. That's gonna affect this knee. All right, so we're not gonna even think about doing anything with the knee. We're gonna work on the muscles surrounding the knee. So we're gonna try to get our foot and ankle a little bit better and work a little bit more on the hips. So you might notice some things that work on your lower back may also work with that knee too, okay? So let's go ahead and keep that in mind. So what we're gonna go ahead and kick through some foam rolling techniques for the quad, the IT band, and for your calves, okay? So first thing we're gonna get into is that IT band, okay? So IT band is a sheath of muscle that goes from your knee all the way up through your hip. So if this is tight, oftentimes people get runner's knee, right? That causes a lot of pulling on that knee joint. So what we want to do is lengthen it back up and be able to kind of get back to our normal routine without any pains. All right, so with this foam roller, bringing it back out, we're gonna go through this real briefly. We got a few, we got like 15 more minutes to roll. All right, so you're gonna be on your side here. So my chest is facing you guys, keeping my body squared up. Bring one leg up and over like on that other stretch. I'm gonna put that foam roller right at underneath where that ball socket is, where your hip is. And I'm just gonna use this arm up here as a lever to kind of lift my body. Woo-hoo-hoo! I found a spot. All right, so there's gonna be pretty much like 3 primary pressure points throughout your IT band. There's gonna be 1 at the top and 2 towards the knee. And you're gonna continue all the way down. When you find a spot, make sure you breathe in and out, hold it for 15 seconds, and then continue on down that list. Woo-wee. This one's screaming at me. So same thing here. If you have any kind of ankle or any kind of hip issue, your IT band is gonna take it over too and cause a lot of pain in that knee. All right, so make sure we're just breathing through it. You don't wanna tense up, all right? That's gonna cause the opposite effect of what we want. We wanna make sure that we're allowing ourselves to give into the pain and discomfort of the foam roller, okay? That's gonna cause a lot of change. All right, so we're gonna have you keep continuing on that IT band for about 30 more seconds. Keep working your way down towards that knee. So you don't wanna go straight on that knee. You wanna go right above the knee, about 2 inches or so, all right? And then work your way back up that leg to the meaty part of the IT band. Just using this foot and this arm up here as an anchor, as a lever, and slowly working our way on down that list. Woo! So there's certain things called active release techniques where you could kind of, like we did earlier, we can move that shin back and forth on that pressure point, causing that muscle to go through that range of motion, but that's a little bit further down the road. Nice work, you guys. All right, go ahead and flip-flop it to the other side. Hit up that other IT band. Maybe you'll find some magic on that side. Same thing. All right, that bottom leg is all the way straight. You're going to be straight on your side. Resting on your forearm, this leg is going to be your base of support. So you're going to use this arm and this leg as a lever, extending your body forward, feeling that pressure. Whenever you find that sweet spot, you maybe feel some tugging in that knee. That's completely normal. Just go ahead and rest on that point. Whew. Make sure we give into the pressure. Let your body just yield. Breathing the whole time. Don't clench your fists or anything. Just make sure your hands are open. Make sure we're as relaxed as possible. Going through inch by inch. Good job, you guys. Whew. There you go. Outstanding job, you guys. All right, and we're going to go just like 30 more seconds on this side and then find some more sweet spots. Beautiful job, you guys. All right, so last thing we're going to get into is our calves. We're going to skip over the quads today because that's pretty straightforward. You're just going to lay on the foam roller on your quads and just roll, get it back and forth. Same thing we did for the IT band, okay? All right, just for a reference, if you want to do that quad, you can just put that foam roller right above that knee. Use your opposite leg as a lever like this, kind of like that Spider-Man lunge or Spider-Man get up or Spider-Man position, and just roll it back and forth from the top of your knee all the way up to that hip and all the way back down. All right, but we're gonna skip over the quad today just for time reasons, and we're gonna go straight down to that calf. All right, we're gonna do one calf at a time just to supply a little bit more pressure. So I'm gonna put this foam roller right at the top of my Achilles. It's gonna be a stringy tendon on the backside of your leg. So I'm gonna go ahead and with my other foot, I'm gonna put it right over the top here. And this foot is gonna always be on top of the foam roller. So that's gonna create more pressure. So I'm gonna push my body forward. As my body goes forward, I'm bringing my foot up just a little bit farther. Bring my foot up just a little bit farther. So from a side view, this is what it'll look like. So I have my foot on top of the foam roller here. I'm pushing my body forward. As I go forward, my foot comes up with it. And then I go right below where my knee is to the top of that calf muscle. And then I'm gonna just go back and forth. All right, whenever you find those pressure points, hold it there. And what we're gonna do, I'm gonna take off my socks because it blends in with the background. All right, so. Yes. All right, mind your own business. Thank you. Dog. All right, so what we're going to do, once you find a little tension area, we're going to go through a series called an active release technique. So you're going to go ahead and put all your weight on that pressure point. And what you're going to do with that foot here, this foot, you're going to pull it towards your face and then extend it out. Pull it towards your face and extend it out. All right, so this is super helpful for people that wear like things like high heels, have any ankle issues, have plantar fasciitis, things like that, because oftentimes this calf is going to stretch all the way down, or if it's oftentimes too contracted, you need to lengthen it back out. Thanks, Guy. I'm doing a class. All right, perfect. So just take your time with it, and we're going to go ahead and just switch on your own. Go ahead and switch over to the other foot. His name's Rocky. He's a nice guy. He's just a little aggressive right now. Sun's going down. He's turned into a werewolf. Very good, you guys. Awesome. All right, go ahead and relax. And we're going to go straight into some stretches real quick. So first stretch we're going to go into. Shoot, I want to do two of them, but I don't think we got time. So we'll go through two of them. All right, so first thing we're going to go into is called a combat stretch. And this is also used as a strengthening technique too. So it's a combat stretch. So I'm gonna be on one knee here, and this other knee is gonna be in front. With this back leg, I'm a, I don't know, turn it inwards, and I'm gonna sit back down on that leg right here. Nice and comfortable. Don't worry too much about that back leg. It's just there for looks and to kind of make you feel a little bit more comfortable. All right, what I'm gonna do, I'm gonna go, I think it's called a gavel hook or something like that. I don't remember. But we're gonna go grab your thumb, grab your hand like this, get a nice comfortable position. But what I'm gonna do, I'm gonna push my chest onto my knee and try to get my knee as close to my toe as I can. All right, so I'm just gonna push my body forward, and then I'm gonna feel without letting my foot come off the ground. So my foot's gonna be completely flat here. Having that gavel hook here. Big breath in, keep my core tight, and I'm push my chest forward into that knee. And see how this makes that angle here? I wanna see if I could decrease that angle as much as possible without my foot coming off the ground. So if my heel comes up, I've gone too far, but I wanna keep it down. Feel that stretch. You're gonna feel a pull on the front side of your foot and maybe even through your shin. And we're gonna go ahead and relax. And you're gonna hold it on each stretch for about a minute, but we're gonna go straight from this stretch into our activation or our strengthening technique, which is gonna be this right here. It's gonna be our combat stretch. So right here, what I'm gonna do, have that gavel hook, put my chest to my knee, and what I wanna do is pull my toes up towards my knee. So once I get to that end of that range of motion, I'm gonna pull my toes up towards my knee. You might not even be able to get your toes off the ground, right? But you're gonna feel all your shin light up, and we're gonna hold it for 10 seconds, 8 seconds, 5, 4, 3, 2, 1, and reset. All right, so you're gonna push your knee all the way forward as far as it can while trying to lift your toes off the ground. All right, so you're gonna be stimulating all these muscles in your shin that oftentimes don't get a lot of love. Also helpful for like shin splints, things like that, okay? All right, let's go ahead and grab that one more time. Get a nice tight grip, keep that core tight, push that knee to that foot, get that full stretch. Once you get to the end range of motion, I want you to lift your toes up, lift them up, lift them up, lift them up. Come on, lift, 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 lift. 5, 4, 3, 2, 1. I want you to hold in this position. Hold it there, big breath in, big breath out. See if you go a little bit farther here. A little bit farther on that stretch. All right, let's go ahead and lift those toes up in 2, 1. Lift those toes up, lift those toes up, lift those toes up. Tighten that grip on those hands. Tighten that grip on that hands. Tighten those grips. 3, 2, 1, and relax. Stay in that position. All right, see if you can stretch a little bit farther. All right, so here we're stretching out our calves and our ankles, and we're trying to activate all the muscles in our shin. All right, what you want to do is tighten everything. So tighten your core, tighten your grip, tighten your arms, and try to lift up those toes in 3, 2, 1. Lift those toes up, lift those toes up, lift, 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 lift. 4, 3, 2, 1, and slowly release it on back. Outstanding job, you guys. There we go. All right, we're going to go ahead and switch legs. Go into the combat stretch on this opposite leg. Same thing, sitting back on that foot. One foot is up. Keep your chest pinned to your knee. All right, so we're going to get to our stretching, our end range of motion. So go ahead and grab that grip. Push that knee to your toes. Just put your body weight on there. We're going to find that stretching position. All right, here we're not really tensing up. We're just letting ourselves stretch. Feel the stretch throughout your calf and your ankle and everything. All right, so now what we're going to do, we're going to tense everything up and try to lift our toes off the ground. In 3, 2, 1. Lift the toes up, lift the toes up, lift the toes up, lift, 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 lift. Flex those quads, flex those glutes, lift, 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 lift. 3, 2, 1. Breathe into the stretch, breathe into the stretch. Stay there, stay there. Don't forget to breathe the whole time, okay? All right, find that new range of motion, and we're going to go ahead and lift the toes up in 2, 1. Lift toes up, lift, 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 lift. Try to get those toes off the ground. Try to get them off the ground. Flex, 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 flex. 3, 2, 1. And slowly relax and go into that stretch farther. We're doing it one more time. Go farther into that stretch. Big breath in, big breath out. All right, let's go ahead and pull those toes up in 3, 2, 1. Pull those toes up. Pull, 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 pull. Flexing everything. Flex, 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 flex. 4, 3, 2, 1. And slowly release it back out. Outstanding job, you guys. There we go. So you should feel all this all this shin, everything on the front side of your leg flare up, right? All right, so that's going to get us reconnected with the muscles in our feet and on the front side of our legs, just so it takes the stress off of those calves on the backhand side, and also you get to stretch it all the way back. All right, so Last stretch we're gonna get into is gonna be called a rear foot elevated lunge. So what I'm gonna do is put my foot onto the couch here. And I'm gonna be back at this 90-90 stretch. So I'm gonna be sitting tall here. And this leg is gonna be elevated onto the couch. And I wanna make sure that I'm in a nice upright posture. What I wanna do, I wanna poke my butt that's down. So the knee that's down, I'm poking my glute. Make sure that it's contracted. So I wanna squeeze my glute as hard as I can and push my hips forward. So while squeezing, squeeze glutes, push the hips forward, hips forward, hips forward. So you should feel that pull all the way through that leg and through that hip. And 3, 2, 1, and reset. Make sure you got a pad under your leg too. All right, so same thing. All right, chest nice and tall. All right, shin underneath the knee at this point. I'm gonna squeeze my glutes. Make sure that I have my back in a straight line. Squeeze my glutes, there we go. And you wanna push your hips forward, push your hips forward, push your hips forward. Squeeze, 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 squeeze. There we go, good job, you guys. Hold it, hold it, hold it. 3, 2, 1, and slowly release. Let's go ahead and switch sides. So it's gonna be super helpful for lower back and also your knee issues. All right, so we're just stretching out that hip complex and also that quad. Let's go ahead and throw that other foot up onto that couch. If you can always work on height on that rear foot too. If this is a little too high for you, start a little bit lower, okay? Or even start on the ground. All right, we're gonna start off at 90-90 position. Squeeze your butt, make sure your glutes are super tight, chest nice and tall. Let's slide those hips forward. All right, and we're gonna hold here for 15 seconds. Usually on your own time, you wanna hold it here for about 30 seconds to a minute. All right, make sure we squeeze and keep that contracted, keep that contracted. 4, 3, 2, 1, and slowly come on back. There we go, make sure we're breathing the whole time. Good job, Susie, keeping your balance. If you need help with your balance, hold on to something or grab a dowel rod, that's perfect. All right, chest nice and tall. Let's slide those hips forward. Squeeze those glutes. Keep everything contracted, tight, tight, tight on the backside. Make sure you feel that pull on that quad and that hip. All right, 3, 2, 1, and slowly release it back up. Awesome work, you guys. There we go. All right, so we're still on our knee, still working on our knees. So these are some stretches and some activating exercises in order for you to feel a little bit of alleviated pain in your knees. So remember, your knee is the epicenter between your foot and your hip. So if there's any issues downstream or upstream, your knee's gonna compensate for it, okay? So you wanna kind of find where and address the issue and then be able to kind of develop a clear plan for that, okay? There's other strengthening exercises we're gonna go through, but let's go ahead and fast track it forward. So we don't have too much time for shoulders. So we'll save shoulders for the next time because shoulders get a little bit spicy. There's a lot of things that go into it, so we're gonna hold off on shoulders for today. They're gonna be inside of the PowerPoint presentation, so I'll just go ahead. I'll send that over to you guys. You guys could go ahead and check it out. So oftentimes issues with shoulders are gonna be problem like within the chest, tension up here in the trap or in the lat back on the backside. So we'll, next time, whenever we do a mobility clinic, we'll focus more on upper body. Today we focus a lot on from the hips on down. Hopefully you guys learned something a little bit from it. But finishing off, what we're gonna go ahead and take a look at is gonna be how to put everything together. Bam. I'm gonna share this real quick. And where's it at? I'll bring it into view, play. All right, so let's go ahead and check it out. So this is an example of a program. So as you can see on the top, it's gonna list the labels. It's gonna go through your steps, your exercise, sets and reps, and your notes basically on how you feel and what you wanna look at. So step 1 is always gonna be inhibit the muscle or foam roll. Step 2 is always going to be lengthen or stretching it. Step 3 is going to be strengthen, and step 4 is going to be integrate. All right, so only do these steps if it's something that's applicable to your situation. For example, if you got lower back issues, if you have shoulder issues, all the way down the list, make sure that it's relevant to you because you don't want to spin your wheels on something or waste your time on something. But it's always good to kind of hit things every once in a while. So this is a program example for someone that has plantar fasciitis. So what their game plan going forward would be was they want to foam roll their calves and the bottom of their foot, and basically has their sets and reps. So just one set of foam rolling, 1 minute, and just kind of notate how you feel. Go down the list. You're gonna lengthen and stretch your gastrocnemius and your soleus, basically your calf muscles. 3 sets for 1 to 2 minutes. You want to strengthen those calves back up. So doing things like calf raises, and then how to integrate into your routine. You're going to be doing a single leg squat. And I think that is it for that PowerPoint, and I'll send that over to you guys. Nice. There was something else I wanted to say. So sorry that took a little bit longer than expected. There's kind of a lot of stuff that kind of mixed into it. What did pop out? I know what I do. All right. So if you guys have any questions or anything like that, go ahead and unmute yourself, because I closed out the sidebar that has everyone's name. So I don't know how to do that from there. But any questions around town? Yes, Miss Susie.
That was great. Byron taught you well.
Well, yeah.
Yeah.
Super helpful.
Oh, yeah. Because the knee one and all those ones we used to do in Byron's classes. So that's a good refresher.
Mm-hmm.
Yeah.
I'm sorry.
Maybe you could have different ones, like just focus on like, lower body, and then have one with an upper body or something like that.
Yeah, I think
That'd be awesome.
Kind of fell that way. So today we did lower body, and the next time we'll do upper body. So then we get into like neck and stuff like that.
Yeah, because I know like Jeanette would have loved this, and I think everybody would benefit from it, because if you don't do this stuff, you just continue being sore and not being able to move. I used to have plantar fasciitis, but I don't. It was tight calves.
Nice. There we go.
Yeah.
Yeah, see?
Yeah.
It's always something downstream.
Yes, it is. That's how I sprained my knee, because when I fell off the monkey bars at the Spartan.
Yeah.
And my ankle didn't turn, it just was solid, so my knee buckled.
Oof. Yeah, I didn't have any of that. You didn't have any brace.
Yeah. Yeah.
I have a question. If it's for the back of your knee, like because I hurt my knee when I was young, and now I have a whole bunch of issues with it. Sometimes I get pain in the back of the knee.
Yeah.
If that's the same thing, you'd foam roll the same way?
You generally, you'd probably want to foam roll the same way, but a lot of things that we went over were from non-contact injuries. If it's something that had surgical intervention or any kind of modification to the knee or anything like that, that might get a little bit more sticky. So probably, yeah, still do do your due diligence as far as foam rolling, stretching, and want to strengthen up the muscles that kind of attach to the knee.
I hurt the front of it, so you think that it just like it's becoming the kind of an all around?
Yeah, kind of like circling or back around. Yeah.
Okay.
Because you tore your knee in half basically, so you're not going to have the support as everybody else would have. So other things are going to end up compensating over for it. But yeah, just probably you don't want to be gentle with it as far as like the muscles go, because those things are going to probably be spasming out and going crazy. So you kind of want to get in there and kind of do a lot of self-release and stuff as far as like in your IT band and those areas.
Yeah. All right. I got to go, Anthony, but thank you.
Hi, Susie. Thank you so much for coming through.
See you in the morning.
But, the workout time is going to be a little bit different. I have an appointment in Roseville at 9, so we're going to probably push the workout to 7:30.
7:30 a.m. or p.m.?
A.m. No,
AM.
my appointment, is it at 9? I got to double check my appointment time. But
Okay.
It'll probably be at 7:30. Mm-hmm.
Okay, that's fine.
Right on.
Yeah.
Hey, guys, thank you so much.
Bye.
I'm going to stop.
Bye. Bye, Susie. Bye, Takia.
Bye.